Hello everyone, thank you for joining me. My name is Dr. Jason Uchida. I'm a doctor of naturopathic medicine and your host of this program. Welcome to Island Wellness, a program designed to educate you about naturopathic medicine. Today is February 28, 2013. I graduated from the National College of Naturopathic Medicine in Portland, Oregon in 1988. I've been practicing naturopathic medicine in Hawaii for the past 24 years. Naturopathic physicians are licensed in the state of Hawaii as primary care providers, just like medical doctors. I have a unique and, I believe, a very interesting program lined up for you. Today we're going to be discussing the weather and how it affects your upper respiratory tract. In many instances, you may not even notice it affects on you. I have two patients joining me to tell you their stories of how the weather has affected their sinuses and how performing a simple but effective therapy has helped them clear their sinus cavity, reduce the size of nasal polyps, relieve ear pain, ear congestion and headaches, improve sleep, mental clarity, concentration, and energy. Then we'll teach you this useful technique that helps drain your sinus cavity from congestion and mucus. The sinus draining procedure is called the nasal lavage or the nasal rinse. Please stay with me to listen to Dennis and Russ tell you how rinsing out their nasal cavity has helped them improve their sinus allergy condition and their overall health. We'll also teach you the most effective way to perform this nasal rinse for maximum benefit. Before we meet our guests, let me give you a brief introduction to naturopathic medicine. Naturopathic medicine is a primary healthcare system founded on the honored universal principle that the human body has the mechanisms in it to heal itself, no matter what the current status may be. Therefore, the human body is the ultimate healer. Furthermore, the physician's true role is to support this process by using modalities of treatment that work in harmony with the body's natural healing ability. Hippocrates, the father of modern medicine, practiced these same principles thousands of years ago. Well, that's enough about me and naturopathic medicine. Let's find out if it works. To help illustrate this, I typically ask a patient or two to share his or her experience with naturopathic medicine with you so that you can get a better understanding of how this safe and effective form of medicine works. Prior to November of 2009, I would see 2 to 4 patients a month for upper respiratory conditions or allergies, 1 to 3 cases a year for sinus infections, 1 to 3 patients a year for ear infections, 1 to 2 cases a month for chronic persistent cough, 2 to 4 cases of asthma per year, 1 to 3 cases of vertigo a year, that's severe dizziness, and less than 1 patient a year for Meniere's disease, which is extreme dizziness. However, since November of 2009, I have seen a dramatic increase in these health conditions to the degree of seeing 1 to 2 patients a week for upper respiratory conditions or allergies, 1 to 2 cases a month for sinus infections, 1 to 2 patients a month for ear infections, 2 to 4 cases a month for chronic persistent cough, 1 to 2 cases of asthma a month, 1 to 3 patients a month for vertigo, and 1 to 2 patients a year for Meniere's disease. So there has been a dramatic increase in upper respiratory problems since November of 2009. What has been at the root of this dramatic increase of upper respiratory problems in the last 3 years have been 2 dramatic changes that's happened or occurred since November of 2009 that can cause upper respiratory tract problems. First, a very large volcanic vent opened up in Kilauea crater, spewing tons of toxic sulfur dioxide or VOG into the Hawaiian skies each and every day. Second, there has been a dramatic and unusual shift in our trade wind weather pattern where most of our days in the past 3 years we have been experiencing Kona weather. These 2 factors have increased our exposure to VOG and its irritating effect on our upper respiratory tract, producing the rise in these conditions. Many of these patients had stated to me that they're not affected by VOG. I replied back, in the past you weren't affected by VOG, but over these last 3 years you've developed a sensitivity to VOG. The VOG has been damaging our mucous membrane lining, increasing your chances of becoming sensitive to VOG and producing these upper respiratory problems. Why are people developing sensitivity to VOG now? VOG is sulfur dioxide. Sulfur dioxide is a deadly and poisonous gas. If 10 people walk into a lava tube filled with sulfur dioxide, probably 10 people will die. With the changes in the weather pattern, we are being exposed to small amounts of sulfur dioxide each and every day, or let's say every other day or so. Over time, this chronic exposure to the acidic VOG will break down the mucous membrane lining in our sinus and lungs and start to produce upper respiratory problems. You may have noticed a change in your upper respiratory health in the last few years. Others of you may be affected but have not noticed. Common symptoms that could be the result of an increasing VOG sensitivity are sinus congestion, sinus or frontal headaches, ear congestion or pain, hearing loss, ringing in the ear, dizziness or lightheadedness, fatigue, difficulty in concentrating, brain fog, chronic postnasal drip, chronic sore throat, and chronic persistent cough or clearing of the throat. Because of this seemingly unrelenting exposure to VOG, the sinus mucosal cavity will continue to fill up with fluid and phlegm. The only way to get relief from these symptoms is by removing the irritant or draining the fluid from the sinus cavity. Unfortunately, removing the irritating VOG is virtually impossible to do. So draining the fluid buildup in the sinus cavity is the next best option. Medications that are nasal decongestants like Claritin don't really drain the sinus cavity. Instead, it dries up and shrinks down the mucosal membrane and the fluid in them, hardening the phlegm and making it more difficult to drain. The best technique to drain the sinus cavity of fluid and phlegm is by physically washing it out or rinsing it out by using a bulb or bottle syringe. I've had many patients say that they've tried the neti pot and it wasn't very effective. The neti pot is not effective because it only rinses out the front part of the sinus cavity and not the entire sinus cavity. The sinus cavity's depth is approximately 2.5 to 3 inches from the entrance of the nostril to above the last molar of your upper teeth. When a neti pot is used to rinse the sinus, it typically reaches a depth in your sinus of maybe 1 inch, with the water draining out of the cavity from the opposite nostril. If you want to rinse the back of your sinus cavity, you would need to propel the saline solution with a bulb or bottle syringe. You will know if the saline solution is reaching the back of your sinus cavity because the rinse will drain out of the sinus cavity through the mouth. Because on the floor of the sinus, at the back of the sinus cavity, there is a trap door called the soft palate where the solution, when it reaches the back of the sinus cavity, will drain out of the sinus cavity by dropping down the soft palate or the trap door into your mouth and where you'll spit it out before breathing it in or swallowing it. The reason we have postnasal drip is because the phlegm in our sinus cavity is thick and sticky, so it can't drain out of the nose. This thick and sticky phlegm slowly drips down and out through the soft palate, down the back of the throat where you may feel postnasal drip, and a tickle in the back of the throat, producing a persistent cough and clearing of the throat. You should rinse the sinus with hot salt water or a magnesium salt solution. The hot water will melt the thick and sticky phlegm to increase its fluidity so it can drain out of the sinus cavity more readily. Sodium and magnesium salts are solvents and mild disinfectants, which dissolves the thick and sticky phlegm, moving it easier and diminishes the spread of infection. There are 6 chambers in the sinus cavity, 3 chambers on each side called turbinates or concha, which are responsible for breaking up airflow and wafting the air and its scent so that odors and fragrances can easily be detected. The concha in each side of the sinus are called the upper concha, the middle concha, and the lower concha, or turbinate. Each concha is long and cylindrical and resembles a turbine engine. Phlegm and mucus can easily congest and clog up the concha, so it's important to rinse each concha twice to ensure maximum draining and relieve sinus congestion and pressure, and potentially draining the middle ear of fluid. Again, there are 5 keys to rinsing the sinus cavity well. 1, it may be best to use a bulb or bottle syringe to to express the saline solution to the back of the sinus cavity, rinsing the entire sinus. 2, it's important to use hot tap water to melt the thick and sticky phlegm to aid in its draining. 3, dissolve sodium and magnesium salts in hot water because it is a solvent and mild disinfectant. And that adds to dissolving the thick and sticky phlegm and diminishing the spread of infection. 4, the solution should be draining out of the sinus cavity through your mouth. This tells you that you are rinsing the entire sinus cavity. The solution will only drain out the back of the sinus cavity down the soft palate and then out of your mouth. So if the water is coming out of your mouth, that means that you're rinsing out your whole sinus cavity. 5, rinse each of the 6 sinus concha or turbinates twice. It will take about 12 ounces of hot saline solution to rinse the 6 concha twice. Now that I've given you the basics on rinsing out the sinus cavity, let's find out if it works. Let me introduce to you our guests, Dennis and Russ, so that they can share their experience with draining out their sinuses with the nasal lavage. Dennis and Russ, welcome to Island Wellness, and thank you for appearing on the show with us.
Thank you for having us.
Yep.
So my first question for you both is, basically, what was the reason why you came in to see me? And tell us a little bit about the history behind your sinus issues. Why don't you go ahead and start, Dennis?
Okay, mine started 3-4 years ago, and I started having polyps up my nose and my sinus problems. And so about 3-4 years ago, and I've been to specialists, ENT specialists, a regular general practitioner, and allergists, done all these things, and got to a point where if you can't breathe, it's not good.
Mm-hmm. Yeah.
So how it came upon you was I've been also taking prednisone, which is a form of steroids, and that really clears it up, but it doesn't really solve the problem.
Mm-hmm.
And mine was coming back even after the prednisone would clear it up, my sinus. It will come back about 3 or 4 months later.
Okay.
And the prednisone, you're only supposed to take it maybe twice a year.
Mm-hmm.
But that's not really solving the problem.
Mm-hmm.
So anyway, this is going on in the last few years. And I got to a point where it kept on coming back. And then I see my chiropractor, who's kind of into naturopathic doctors and medical stuff. Anyway, he recommended, I know it's Dr. Uchida. And I think twice he mentioned your name. The first time I said, naturopathic physician? Yeah. So, but then I got
common comment anyway.
Right. But in a sense, it was good because you're kind of like a last resort.
Mm.
So after about a year later, I asked him again, what is your doctor's name? Dr. Uchida. Because I was desperate. It had gotten so bad that I don't want to keep taking prednisone, which I know cures the symptom.
Right.
So like Russ said, cures the symptom but not the cause.
Okay. How long were you taking the prednisone or steroids for your sinuses?
Off and on for about 2 years.
2 years, okay.
Off and on.
Along the way, though, your sinuses were getting pretty bad where you had developed a fairly large nasal polyp.
Yes.
Explain that.
Well, I don't know the cause of the polyps, but it started off, and I've been fine. I'm getting older. Maybe that's a part of the cause of it, but it started off just with sinus problems, hard time breathing, and then at one point got kind of bad where I said, I got something in my nose, and I went to a physician and said, you have polyps in your nose. So that kind of started the medical thing where I try this, try Flonase, try the rinse, and then the ultimate was prednisone, and that clears it up like that. But then it comes back again.
Right. So nasal polyps develop because of chronic sinus mucosal irritation. So the irritation causes the mucous membrane lining to swell. And if it's a chronic type of situation, then the mucous membrane lining can start to grow lumps, let's say, on it. And over time, these lumps or polyps will grow larger. And Dennis, your polyp was so large that it was actually exiting your nostril.
Almost.
Right?
Close.
On the left side.
Right.
Yeah. So you could easily see it, though, if you look.
Yes.
Right. So it had almost exited, but all right. So if you can imagine a nasal polyp that large blocking your airway, actually, right?
Yes.
Okay. So You could not breathe in through your nose.
Not at all.
Okay. Corticosteroids, typically they decrease inflammation, so they'll shrink the mucous membrane lining, right, initially, but it doesn't solve the problem of what is irritating the sinuses
Exactly.
and preventing it from coming back.
Right, and that was the problem.
And eventually, corticosteroids, if used chronically, will actually cause more problems for the mucous membrane lining and the sinuses. It actually breaks down tissue, where then you become even more sensitive or allergic to the environment.
Right. That's what I was afraid of, because even the doctor said that you cannot use this prednisone more than 2-3 times a year.
Okay.
And this is going on like my second year already, and I said I can't be doing this.
So one of the options he gave you was performing surgery to
Yes.
remove the nasal polyps.
And I've talked to, it's a common problem, I've talked to people at work, on the phone, friends, and a lot of people have had that surgery, which surprised me. But I found out that's not always the panacea or the problem solver either, because it's kind of like a 50-50 chance.
Mm-hmm. Meaning?
It may clear it up. Of course, it'll clear it up when you clean it out, but that doesn't cure the problem. Because, and the doctor will tell you, the surgeon will tell you also that it can also come back.
Right. Because you're not fixing the cause
Right.
of the nasal polyp.
And I've talked to people, it's kind of like half-assed. Some who's had the surgery have been very successful and they swear by it.
Mm-hmm.
And the other half said, oh, I wouldn't recommend getting it. Because they went through all that, and it is painful and all. They went through all that, and then they cleared it up, but then it came back again. So why go through all that when, you know.
You're not really,
Right.
you're going to be in the same place maybe a few years later or something.
And last year, that's where I was at.
Okay.
We're trying to decide whether to get surgery or something else.
All right.
And you are the something else.
Okay. So we're going to find out what that something else is and how well that something else is working. So, Russ, how about you?
Yes.
What was your road to coming in to see me?
Well, initially, I've been having ear pains in my left ear for probably about 6 months.
Okay.
And I went to my internist, who then thought it was an ear infection. He put me on the antibiotics. So after that week of antibiotics, I still had my ear pain. So he then referred me to an ENT, a ear, nose, throat specialist, which then kind of came up to the conclusion that what was causing my ear pain was acid reflux. So he then prescribed me on omeprazole, and then also some acid reducers to stop the acid production in my stomach from coming up into my nasal cavity.
Okay.
So I've been on that for about a month, but I would still have my pain. The ear pains wouldn't go away.
So you didn't receive any relief from that treatment?
No, nothing at all.
Okay.
And it was to the point where I was getting frustrated, you know, like Dennis, where, you know, something wasn't working, you know. And I did little research on the effects of antacids, you know, omeprazole, where it's not good taking over a long period of time. So I, you know, again too, you are my last option, where I have family friends that actually saw you for different conditions and recommended you, along with a business colleague who had a similar ear condition, said to give you a call. So that's why I came to see you. You know, in addition to my left ear pain, I would also be congested, where I would have a difficult time breathing. And, you know, I would always feel stuffy, like coming down with a cold. And then I would have headaches or pressure in my eye socket, so I'd have to press my eyes to relieve the pressure. So it was a combination of problems that I had.
Right.
So
You first came in to see me in November.
correct.
Okay, and you were suffering with the ear pain and the
Correct.
sinus congestion for about 6 months.
Correct.
You never had sinus problems before then?
No,
Okay.
never.
All right.
And it just started recently, you know, within that 6 months, where, you know, I would have a shortness of breath. So I thought it was something I had an upper respiratory or some kind of ailment, which, you know, turned out to be negative when I did my physical tests with my internist.
Okay. You had mentioned that you were suffering from frontal or like sinus headaches.
Correct.
How bad were those headaches? How often did you get them?
You know what? It was pretty frequently. I would say at least 1 to 2 times a day, to the point where, I would be taking aspirin to relieve the headaches, but that still kind of didn't do the job. So, between the ear pain and my headaches, my congestion, it was pretty bad.
Okay. Russ, you also experienced postnasal drip.
Yes.
Could you tell the audience a little bit about that, how that felt?
Well, the postnasal drip, I would always have a runny, drippy feeling in the back of my nose, where I would have to constantly blow my nose, where I thought it was initially allergies. So again, that was another symptom or another issue I had with my sinuses.
Mm-hmm. And you discussed this with the ENT.
Yes.
All these symptoms.
Between my internist and my ENT, I told them exactly, my symptoms, what I had, and both of them didn't think really much of it, and when I first came to you, the first thing you did was you looked in my ear and you said, the reason probably why you have ear pain is you have fluid in your ear. I mean, that's something that was something so simple that you just recognized like that.
Looking in your ear with like a light, looking at the tympanic membrane, looking behind the tympanic membrane, which is the middle ear chamber, and the fluid was there producing some pressure against your ear, causing the pain.
Correct.
You both had mentioned that you had seen internists and ENTs, and you mentioned that I was the last resort. Because you felt I was the last resort because you tried everything that they had recommended, and nothing had really worked.
Correct.
Well, I tried, like you said, specialists and my regular doctor, and to me the last resort was to get the surgery done.
Right. Oh, okay.
Get the polyps out.
Okay.
And that's always the last resort.
Right.
But now you're my last resort.
Okay.
Which is better
before
than
getting the surgery. All right. Okay. So we know that you both had a lot of sinus congestion. So for you, Russ, the fluid in your middle ear was getting in there because your sinus cavity was filling up with phlegm or mucus or fluid. And the fluid was getting into the middle ear chamber because your middle ear chamber is about the level of your eye, maybe a little bit below that. So the amount of fluid in your sinus cavity was at least up to your eye level, maybe even higher since you had the forehead or the sinus headaches.
Correct.
All right. So I had mentioned to you the best way to drain the sinus cavity was using a technique called the nasal lavage or the nasal rinse. A lot of people understand that as being using the neti pot. Had you done that before, Russ?
Myself? No. Myself, no.
You had never used the nasal rinse before?
Not prior to all these problems. Like that.
Okay.
And I've tried over-the-counter commercial, supplements or like vitamins. There's a well-known one on the market, and I won't mention brand names, but it's for sinus problems, and it lists about 10, 15 different sinus problems. And depending on what problem you have, you order this specific thing. And it's for sinuses, specialized. You take one pill, and it's supposed to be a cure-all.
Okay.
And online, you can Google it like that. It's panacea for all your sinus problems.
And you tried that?
I tried that.
You gave it a good try?
I thought at first it was working at first.
Okay.
Because it seemed like, this thing started clearing up. Maybe it was coincidence. But after, I'm pretty sure I used it at least 3-4 months.
Okay, that's a good try.
And it takes a while too.
Right.
And eventually, but one thing, it gets kind of expensive. And after a while, I'm thinking, you take one pill a day, and it's supposed to cure everything up here.
Oh, okay.
So
that would be a miracle.
I tried that also. I tried that also, and that didn't work. Good.
That was a natural product.
Yeah, it was.
Okay.
It was not like even over the counter per se from Longs or places like that. It was online. You can only get it online, I guess.
Okay. I gave you both some naturopathic, herbal, vitamin, mineral formulas to drain your sinuses also. But the downside with that is they are safe, and they do drain the sinuses, but they do cost a lot of money over
Yes.
time. So the option to that would be rinsing out the sinus cavity. And Russ, had you ever done a nasal rinse before?
Unlike Dennis, yes, I did.
Okay.
I've tried that neti pot, and I tried it for about a month prior to coming to see you. And, you know, after the 1 month, I still had the same symptoms. It didn't go away.
Okay.
And, you know, now I understand why using the neti pot is not good as, say, what we're going to talk about later on.
Right.
But, you know, in your response to supplements, you know, they are a little expensive, but if you're looking long term, I believe in it. You know, between that and the nasal rinse using the bulb, which we're going to be talking about, that is the biggest saver for me.
Okay. So the neti pot wasn't very effective on draining your sinuses.
No, it wasn't. Basically, I would still feel the same for the 1 month.
Okay.
And it was because the neti pot only gets a certain part of your sinuses and not the complete middle and upper, which, you know, you discussed.
Right, okay. A lot of patients mention the same thing. When I ask them if they used the neti pot before, a lot of them will say, yeah, I used that and it wasn't very effective, so they stopped. And the reason why is because the neti pot you kind of pour into your nostril.
Correct.
And it only rinses the first maybe half of the sinus cavity, the outer half. But the sinus cavity does go back into your skull quite a ways, about maybe 2.5 to 3 inches from your facial bones. And the fluid comes out of your other nostril typically, right? So. When we discuss the proper way, or maybe the better way to drain out your sinuses with using a bulb syringe or a bottle syringe, this is a bulb syringe. I don't know if you're using this one, Russ.
It's a little bigger than that.
A little bigger than this. How about you, Dan?
I use that squeeze bottle.
A bottle syringe. So the reason why is the sinus cavity does go back fairly far into the skull, about 3 inches, let's say. So you need to rinse out the whole sinus cavity. And you can only get the water back there by projecting it back there.
Correct.
Right? Because if you're just pouring it in with a pot, it's not going to be able to reach the back part of the sinuses. And we know if you are getting the solution, the saline solution, to the back part of the sinuses, when the water is, or the solution is draining out of your sinus cavity through your mouth. Right. So, and the reason why is there is a soft palate at the back of your sinus cavity that is like a trap door. So if anything goes back there, it's just going to fall through the trap door into your mouth, and then you have a chance to spit it out. So obviously, it's not a comfortable thing to do, right? Using the nasal rinse. Tell us a little bit about your experience with using the nasal rinse and the bottle syringe the first couple of times you started to use that technique.
It's kind of strange, and it does sound strange and sounds weird. In fact, I have grandkids. They're also going to watch me do it. They'll come, oh, Papa, have you done it yet? But it comes down to maintenance, just like anything, like your car, change oil, you got to do maintenance. And to me, that's what it is. I know the first time it's kind of strange, but it seemed to help because, you know, doing that, and especially the way after you draw your diagrams, the proper way a better way to do it is you see that junk or clunk actually draining, coming out.
Right, the phlegm draining.
And you know, all that was up here. So it does work, it does feel better.
You felt better right away?
I mean, I still had my polyps and stuff like that, but as far as the draining, I know it helps.
Okay.
It's not a cure-all for all this up here, but I think that's where your supplements and other thing comes in play.
We'll talk about it not being a cure-all in a few minutes, though. What about you, Russ? How was your experience the first time, 2 times you did the nasal rinse? I mean,
initially,
no one wants to put water in their
That's right.
sinuses.
I mean, if you can imagine, going to the beach and water going up your nose, that's the exact feeling I had the first couple of times. It was a bit challenging at first,
Right.
but the more you do it, it becomes second nature.
Right.
So like Dennis was saying, that the first couple of times I did it, I mean, I would see crud coming out of my nose and then also my mouth. And I didn't realize that you need to get it way back deep into your sinuses to clear it out.
Right.
And within that first night, I felt a lot relieved. I mean, my nasal passages felt a lot clearer because I didn't realize I had so much gunk in there. Typically, that when I did do the neti pot, none of that would come out. So that's why that nasal bulb really, to me, does a job that gets all the way back into your sinuses.
There's a couple of other keys too, though, with draining the nasal cavity that we talked about on your first visit. One is using hot water as part of the solution. Hot water, because the reason why the sinuses aren't draining the mucus is because the mucus or the phlegm is fairly thick and sticky. That's why it's not coming out of the front of your nose. And to help it drain out, we got to melt it so that it can dislodge from the sinus cavity and drain out of the mouth or the nostrils. And we also use either a little bit of salt. You can use table salt, Hawaiian salt. It doesn't matter, but typically, let's say about 1/4 of a teaspoon per 10 to 12 ounces of hot water. And salt or magnesium salts that come in the packet. So if you have hypertension, you're concerned about using salts, you might want to use the magnesium salt packets that they sell at Long's drugstores or CVS, Costco. The health food stores typically carry them too. Basically, they are mild disinfectants, prevent infection, but also they are solvents, so they help dissolve the mucus. And if you use that combination, the mucus will flow right out of the sinuses. Yes. All right, the sinus cavity is fairly big. Right. It typically is from the bottom of your nose all the way to the top of your forehead. So that's a fairly large area, and it's both sides of your skull. And like we had talked earlier, there are 3 concha or turbinates called the lower, middle, and upper turbinates or concha that we have to rinse out because the phlegm will get kind of tangled and stuff in there. So kind of give us an idea of what it feels like when you rinse out those turbinates. So, and we have to aim the water in certain directions to make sure we clean out each individual turbinate. So to give you an idea at home, the lower turbinate is about the level of your nose, and then the middle turbinate between just about your eye level, and then the upper turbinate up a little bit above your eye. So it does take a little bit of practice and work to get the solution in those areas. Right. What was your experience?
Well, in my case, because of my polyps, and if you do the rinse just by, I guess, reading instructions like that, basically you just say you just squirt it up your nose.
Right.
But that's why I was glad that you explained all this, even through pictures, to make it clearer, describing the sinus cavities and the proper way of doing it. In my case too, because I had polyps, I couldn't just squirt it straight up. And remember that you got to squirt it on the inside portion where it would get up there.
Right.
So having someone explain all this, that it really helped, I guess, better as far as the rinsing, stuff like that, where it really helps rather than just squirting out.
Just no technique at all to putting the nozzle in your nose and just squirting.
And I tend to be a logical person. Like when I first heard about the Nelly pot, I was thinking, well, that sounds good, but how is it going to work as far as with the pot, like you said, just
with your polyp?
Just kind of like just draining it.
Right.
Versus even a bulb like that, which actually, like you say, you need force to get it up there. So in my case, I mean, your drawings really help, and your explanation how to do it properly.
I guess I'm gonna have to draw you
You're
some
gonna have to
pictures.
draw
I don't
pictures.
think I draw very well, but
helped
Dennis
me.
and Russ really liked the pictures, and they were
helped me.
talking about them. So I'll draw you some pictures. You probably will be seeing it before we actually.
That's better
talk.
than
We'll cut it in.
your medical journal
Oh, okay,
picture.
the pictures in the medical books. All right, Russ. How about you?
You know, it's similar to Dennis. The hardest part, or the most challenging part for me, was learning at what angle to squirt the water in.
Right.
Because the angle of you putting the solution into your sinuses is important, because you want to catch the lower, middle, and upper. It took some testing and some trials, but initially I got it. And I think one of the things that you had mentioned was, if you're doing it correctly, majority of the water will be coming out through your mouth and not through your nose.
Right.
Because initially, more of the water was coming out through my nostrils and not my mouth. So when you drew the diagram, kind of showed me where the angle of the nozzle needs to be, the syringe. Majority of the water should come out through the back of your mouth.
Right.
And that's what I'm doing now.
Okay.
And, you know, it's a little uncomfortable at first, I'll be honest, but once you get used to it, it's going to be second nature.
Yeah. And it actually feels pretty good. All the patients that
Oh yeah.
Correct.
talk to me, they
Right.
say, oh, they just love how they feel after they do the rinse.
Right.
Because it
Correct.
really does clear out the sinuses quite a bit. So Russ and Dennis, you guys both made important comments regarding the position of the nozzle that's going into the nostril. Because most of the time, let's say we're sitting in your right sinus cavity, and the nasal septum is the wall or the windows that Russ and Dennis are sitting next to. Typically, when your sinuses are filled with phlegm, they may be congesting the mucous membrane lining. And what happens, or how I can tell there's a lot of congestion in the mucous membranes in the sinuses, is we're going to see mucous membrane tissue encroach into this sinus cavity, kind of basically filling up this whole room. And that's why when Dennis mentioned you gotta put the nozzle close to the nasal septum or the midline of the because then you can wiggle the nozzle away from the tissue that's encroaching into the sinus cavity. Excuse me. Or maybe even get it beyond the mucous membrane tissue and then squirt it into the sinus
Right.
cavity, getting it to the lower, middle, and upper concha or turbinates in the sinus cavity. A lot of patients will say, you know, when they first try it, in the past anyways, yeah, when I squirt the water into my sinuses, it just bounces right out. And the reason why it's bouncing right out is because they're aiming it in the middle of their sinus cavity, and it's hitting the mucous membrane tissue that's sitting in the sinus cavity, and it's hitting the tissue and bouncing right back out. So it is important to use the nasal septum or the median septum close to the mid area of your skull, and rest the syringe's nozzle right against there to get the water into the back of the sinus cavity. How did it feel when the water started to get into the back of your sinus cavity? A lot of people might be thinking out at home, you're like drowning because the water's getting back there and then it's coming down into your mouth.
Well, for me, actually, it does feel good. Initially, it's a little, maybe a little uncomfortable, but now if I get lazy and say I miss, because I do it twice a day.
Okay.
If I miss one, it's like I missed something.
Okay.
You get lazy.
Right,
Oh, I
right.
don't need that. And then the next day is like, I missed something.
Okay.
So it's kind of like, again, maintenance,
Mhm.
where, it helps a lot.
Okay.
And you feel better. To me, anyway.
Yeah. Yeah, I do. I rinse my sinuses, even though I don't have bad sinus problems. I do rinse it maybe 2 or 3 times a week, just as maintenance. And I did rinse my sinuses last night, getting ready for this program. How about you guys?
I
Did
you
it
rinse
this
this morning?
morning. This morning.
I do it twice a day,
All
morning
right.
and night.
yeah.
All right. And that's typically the, let's say, the dosage of doing the nasal rinse. If you do have chronic sinus problems, do it twice a day first thing in the morning and then again before you go to bed.
Correct.
So we talked about it's not a cure, right? You do have to do it regularly to gain ground. Maybe people at home are wondering, why isn't it a cure? You know, if it's draining your sinuses, then eventually you should be able to drain it enough that you're cured. But basically what's causing most of our sinus problems in Hawaii now, because I mentioned earlier in the program that I'm seeing a lot of people with upper respiratory problems and even problems like vertigo and Meniere's disease, is the VOG, right? There's an irritant that's causing the fluid to build up in our sinuses, or irritating our sinuses that's causing this phlegm buildup in our sinuses. We haven't had a VOG problem like this ever before, since since Westerners have been here. And unfortunately, the weather pattern has changed a lot in the last 3 years, where we have many more days of Kona weather than we did before. So the trade wind weather pattern has changed. So that increases the incidence of our exposure to VOG, which is sulfur dioxide, toxic chemical irritant for our sinuses. Were you bothered by VOG before?
Not until I got older.
Okay.
But things like that, I'm guessing maybe about 5 years ago, started bothering me, just like with New Year's.
Okay.
With smoke and the fireworks like that. And I don't know whether, I don't know if your body's breaking down or what as you get older.
It does, unfortunately.
But that's when I started noticing my problems and maybe
being more sensitive to airborne things.
Right.
Okay. How about you, Russ?
Same here. You know, I've probably had sinus problems for a while, and I've never really known it, and, in my younger years, there would be Kona weather, I would get congested, but I didn't think that was anything. And then, like Dennis, the last 10, 15 years, I would start to get affected by Kona weather.
Okay.
And even more so now because, I travel to the Big Island for work. So if I go to Kona, I just fly in and fly out. The next night, that same night, I'll usually feel it.
Mm-hmm.
That was before doing all this rinsing.
Okay.
Now that I'm doing the rinsing and I'm on the supplements, when the Kona weather does come or when I fly over to the Big Island in Kona, I don't get affected as much. But, and I think it's attributed to the nasal rinse.
The rinsing.
Correct.
On a regular basis.
On a regular basis, twice a day.
Okay. So are you noticing more of an effect on the weather in your sinuses now that you're more in tune with your sinuses?
I feel that way.
You feel that that you can tell when it's Kona weather or when there's a lot of VOG?
Mm-hmm.
Yeah.
I do too.
And, a lot of patients will mention to me when they first come in, and I say it's a sinus problem causing their ear infections or their postnasal drip or their chronic coughing. And they'll tell me that I'm not sensitive to the VOG. And, I tell them, well, you weren't before.
Right.
But because this problem has been a long-term problem now for about a little over 3 years,
Mm-hmm.
Our sinuses are wearing down because of the toxic sulfur dioxide irritating our sinuses. That pretty much most of us now are sensitive to the VOG because of this chronic exposure. When I had mentioned that maybe the VOG was causing your sinus problems or worsening it, what did you think about that?
Well, I think for me, again, that seemed like a logical reason as far as why and what's causing it. Because it does seem like within the last few years that it's gotten worse as far as the VOG.
Mm-hmm.
And I guess, like you said, it's probably because of the weather patterns like that.
Mm-hmm.
And I think you mentioned that on the Big Island too, there was a vent that opened up, vent in the volcano.
Right,
opened up, which causes more VOG.
More VOG, that's right. I mean, that vent is really large and it's spewing out tons of sulfur dioxide every day. And we're getting a little bit here, but a little bit every other day or so over a long period of time becomes a lot of exposure.
Right.
Yeah. All right. You're also taking some supplements to drain out your sinuses. Do you feel like these naturopathic supplements to drain your sinuses work? And why do you think so?
Well, for me, I'm sure it works, because I had to switch my general practitioner. I got a new doctor a few months ago, and I honestly put down, what I was all taking, all the medication like that. So I guess he's strictly medical, and he doesn't like you taking anything except whatever is prescribed.
Okay.
So I actually stopped for a week of
Okay.
the supplements.
Okay.
I
Good
did stop
test.
for a week, yeah. And then it started flaring up again.
Okay.
So basically I said, well, blankety blank with that, because I started taking it again.
Okay. And it cleared up.
Oh,
All right.
definitely. So
Yeah.
that's my personal experience.
Okay. How about you, Russ?
For me, the supplements do work. My ear pain is non-existent. It's gone away.
Okay.
And I attribute it to the sinuses. Helping drain the sinus, and then also my nasal rinse. So yes, I'm a believer in the supplements.
Okay. That's true. We're talking about the the nasal rinse or the nasal lavage as being this really, really beneficial thing, but the audience, they haven't heard yet from you two how much better you're feeling. So, Russ, you had mentioned that you had come in to see me because you're suffering from ear pain, and you had mentioned that has gone away. But you also had a few other symptoms.
Correct.
The postnasal drip, the headaches.
The headaches, the pressure in my sinuses, all went away. And like I said, I think it's attributed to the nasal rinse and then the supplements.
How quickly did they go away?
Probably within the first couple of weeks, I started seeing results. It takes time for it to kind of go away, but it works.
You can feel better.
I can feel better. Another thing I've had too was I would have shortness of breath or kind of difficulty breathing, just because my nose would be clogged all the time. And again, I cannot stress enough, with the rinse and the supplements, I have an easier time breathing now. I'm not as congested.
Okay.
So it's a 180 degrees turnaround.
How's the headaches?
Headaches went away.
You said you would experience them maybe twice a day.
Yeah.
You don't experience them at all
No.
now?
No.
You also mentioned that you had sleep apnea.
Yes.
Talk a little bit about that, and how do you feel now?
Well, I was diagnosed with sleep apnea, so I sleep with a CPAP machine. And around that same time I started having my earaches. When I would get up in the morning, I usually feel refreshed because I have the CPAP going through my nose. During that same time frame, I started to feel tired again in the morning, and I couldn't figure out why. So I had the machine checked out, everything, the pressure was okay, everything was fine. And it's only then when I came to see you initially, you said my terminates were plugged. So that could be a reason why I was getting tired in the morning, because my terminates was plugged.
So you couldn't get as much oxygen into your body?
And I didn't feel as refreshed in the morning like how I would previously. So now it's kind of back to normal, where when I get up, I don't feel that tired, dragginess feeling with the CPAP. So I believe my terminates did shrink.
So you're sleeping better?
Oh yeah, a lot better.
How do you feel that? How do you feel like you're sleeping better? What does
Well,
that feel
just
like?
when I know I'm in a deep sleep, and when I get up, I feel refreshed. I don't have that draggy kind of feeling in the morning.
And you're not feeling fatigued anymore?
No.
Okay.
No.
Dennis, yours was, a lot more physical, right? Because you had a nasal polyp developed. It was blocking up your major airways. And you basically couldn't breathe through your nose, right? You had to breathe through your mouth.
Right, correct.
And if that's uncomfortable, if you ever want to experience that, try, pinching off your nose for an hour. It's uncomfortable, especially when you're trying to sleep, too.
Right.
Can you explain how you can feel the improvement in those areas?
Well, that was a big problem with the polyps, is that you can't sleep good, because you can't breathe through your nose, so you have to breathe through your mouth. And when I had the polyps really bad, it's like getting up every couple hours, because you're not sleeping good. And get up every couple hours, and you got to try to blow your nose, drain whatever you can.
Right.
But again, it's not like a complete sleep. Whatever it's 5, 6, 7, 8 hours.
Mhm.
Every couple hours I'll be getting up. So of course the next day
You
I'm
feel
tired.
tired.
Yeah, I doesn't feel rested at all.
So you were feeling tired for a while.
Oh, definitely.
How's your energy levels now?
Wow, a lot better when you can breathe. You know, I mean, you don't realize. I guess you take a lot of things for granted.
Mm.
And when you can't breathe, I mean, you know it too. When you can't breathe, there's no alternative. You got to be able to breathe through your nose.
Right.
And it gets to a point where you try anything, including especially Dr. Uchida. You'll try anything
Yeah.
to be able to breathe.
Yeah.
And now I'm sleeping a lot better. You feel rested,
Okay.
and I don't get up every couple hours just to say because I can't breathe.
How's the nasal polyp now? I mean, it's fairly large, right?
Oh,
In one of your
definitely.
nostrils, it was almost exiting the nostril.
Yes.
You could easily see it if you
Just look.
looked up your nose.
Yeah.
How's the nasal polyp now?
Well, I would say it's controllable. It's not 100% cured,
Right.
but it's very controllable because before I came to see you, like I explained, my polyps would develop every 3 or 4 months.
Mm-hmm.
And at that time, the only so-called cure was to take prednisone, which is a steroid,
Mm-hmm.
and that's not good.
Mm-hmm.
And after I was taking that off and on for about 2 years, and I was telling myself, I can't be doing this.
Mhm.
And again, the alternative to that was surgery,
Mm-hmm.
which I found out is not a cure-all also.
Mm-hmm.
So coming to see you, I mean, it's not one thing, but you explained the rinse, the supplements, and other things like that where it helps. And knock on wood, it hasn't come back
Mhm.
per se as bad.
And it's been a while, right? You came in to see me June
Last year.
2012. So, and today is February 28th, 2013.
Well, like I told you, last May, I remember this day specifically, was the last time I took prednisone because it had gotten so bad that I told my doctor I need it. So, of course, when I took that, it cleared up right away. But then I'm thinking to myself, previously 2 or 3 months prior to that, I had taken it again.
Mhm.
So, and the doctors tell you can't be taking this all the time.
Right.
So after I cleared it up, then I felt real good. But then I think it was like, well, now, what am I going to do in 3 to 4 months? I know it's going to come back.
Mm.
And that's where I was getting desperate again. I said, I can't be taking this again. So what do I do? And
You-
that's where,
You were being proactive. And that's a good point you'd mentioned. The last time you took prednisone or any other corticosteroid was back in May of 2012. So it's been, I don't know, about 8 months now.
almost
Yeah,
right
that
on a
you've gone
year.
without medication. Have you gone without medication for 8 months before?
Definitely not, no.
All
Like
right.
I said, it was about and I tried to stretch it out.
Right.
Because I know prednisone works. I would try to stretch it out as long as I can, 3 to 4 months.
Mm-hmm.
But again, that's not the answer for all these, I know, but I mean, you know it too, when you have medical problems, you just want it cleared up.
Right.
Doesn't matter the cost, you want it cleared up.
Mm-hmm. I'm glad you're feeling good about it. Cause,
No, I am.
It's not an easy thing to do, right, doing the nasal rinse. It does take some time. It's uncomfortable initially. Most people are a little bit clumsy when they're doing it initially, but
Mhm.
over time you get pretty efficient at it.
Oh, yeah. It's like a routine stuff where it becomes like brushing your teeth. To me, that's what it is. It's
Yeah.
something that I have to do it.
Hmm.
Because like I say, if I don't do it, it feels like I'm missing something.
And Dennis, how long does it take you to perform that now? Because you're rinsing each sinus cavity and each nasal turbinate or concha twice. So that means you're doing 12 shots of fluid in your sinus. So how long does it take you to
It's not like I
accomplish
spend
that?
a half an hour over the sink.
Right.
It just takes a few minutes.
It really does only take a few minutes, probably less than 5 minutes
Oh,
or so.
yeah.
Yeah,
Yeah.
I would say less than 5 minutes.
Less than 5 minutes, Russ. So, Russ, a lot of people are probably wondering too, are you taking any medication for your sinuses?
No, all I'm doing right now is taking the supplements, and that's it. Initially, at first, when I did see my internist and ENT, they did initially prescribe nasal steroids. It was Q-nasal, I believe.
Okay.
But then, again, you do that, it works fine, then it comes back.
Right.
So I too, like Dennis, didn't want to be on steroids for the rest of my life. So, other than that, that's the only thing I'm taking is the supplements.
Is a supplements
Yes,
now? Huh?
correct.
Okay. So we didn't, or I didn't finish what I was talking about with regards to your sinuses filling and why you have to keep doing the nasal rinse, let's say every day or at least regularly. Is I tell my patients that you look at the sinus cavity. If you do have upper respiratory allergies, or you are affected by airborne allergens like the fog, for instance, that the irritant is going to irritate your sinus cavity. It's going to fill it with fluid. So I have them look at the sinus cavity as being like a sinking ship. The ship is filling up with water, and we have to bail that water out to get the fluid out of your sinuses so you can feel better and breathe easier. But let's say when it comes to fog in Hawaii now, we're exposed to that regularly. I don't know if it's every few days or so, but let's say regularly. So the sinuses are filling with fluid, the ship is sinking. And the only way we can prevent it from really sinking is to keep bailing water out of the sinking ship every day. And the bailing part of it is the nasal rinse that the gentlemen are talking about. So they keep up with the ship filling up with fluid by bailing water out every day. So Dennis, I know you probably didn't know much about naturopathic medicine before.
Well, on a general knowledge, because I try to be, not maybe necessarily organic 100%,
Okay.
but I kind
You
of
try to be healthy.
Yeah,
Okay.
kind of knew about it.
Oh, you went to a chiropractor.
Chiropractor.
Right. So I want to mention Dr. Ward Ryder's
Yes.
name. He's your chiropractor.
Right.
A good friend of mine.
That's
Very
what
good chiropractor. by the
Right,
way.
that's where your name came up.
All right.
From a desperate patient.
So tell us more about your situation with draining your sinuses.
Oh, well, again, I knew about the sinus rinse also. And actually, I guess it started, I think before I saw you, because I went to see ENT and my general practitioner, and they mentioned sinus rinse. But again, I think coming to see you was the best thing, because you can see it, watch it, read the instructions. Not the same as having a professional actually explain the reason you're doing this, the proper way, a better way to do the rinse,
Okay.
and then with the hot water.
Right.
And it's, I think like Russ said, at first it's a little uncomfortable, but again, it becomes maintenance, secondary nature, where you automatically do it. And then that's it. It does help clear, like for mine, knock on wood again, I haven't had my polyps come back as bad, especially, so I can breathe.
Very good. You mentioned that your internist and maybe even the ENT went over how to do a sinus rinse with a neti pot maybe, but they just handed you instructions.
Well, they didn't even hand me instructions.
Oh.
They said it's it's available.
It's online. Oh, they just
Whatever. You go to the store and the packet itself, the sinus rinse has instructions on how to do it too. But it's not the same as someone who knows how to do it the better way and the proper way, and using hot water, and the proper way to do the 3 terminants or whatever you call
terminants,
it.
right.
How to rinse that out, and the proper way to get it past, like in my case, the polyps like that. But before, like you said, if I tried to do it straight up, most of it would just come right out.
Right.
Would come back out because I
Right.
wasn't doing it properly.
Tell us about what you feel about naturopathic medicine now. Because you didn't know much about it before.
Yeah, not really.
Okay.
But I'm a believer that, especially when you have a doctor, professional recommending you take these supplements. Again, I don't even take aspirin or Tylenol, very rarely.
Okay.
I don't get very many headaches, but when I do, I kind of like tough it out.
Right.
So I don't like to take a lot of even over-the-counter medicine, pills. I don't even take cough syrup or cough stuff like that. So I have no problem with taking naturopathic supplements like that. I don't know what's in it, but you're recommending it, so hey, I'm going to take it, and it's been helping. So I don't know. I'm a believer in that.
What would you want to say to anyone who is suffering from chronic sinus problems, or a lot of people don't even know they have a sinus problem? You know, they have, let's say, a chronic cough or chronic postnasal drip, maybe even pressure in their ears, or maybe even pain in the ears.
Well, I think, like for myself personally, it comes down to just being comfortable and healthy, being able to breathe. If you have sinus problems, I mean, you know it too, you can't breathe.
Mm-hmm.
And that's kind of like, I don't know, it's a stoppage right there. You don't feel good, you're tired, you don't sleep good,
Mm-hmm.
a whole bunch of other problems. And again, I've been through all of it, where the last resort is seeing a surgeon. I've been to allergist, ENT, my regular physician, and as far as I'm concerned, they really didn't fix my problem.
Okay. So you gave it a good try. You didn't just
Definitely.
jump from your internist to see a naturopath. You saw allergists, ENTs.
Well, to be honest, I never knew you existed. You know, you were never there, which, to be honest.
Yeah, not
And I
too many
do-
people have heard of naturopathic medicine.
Right, and then I see Dr. Ryder, my chiropractor, who I go on a regular basis, for natural adjustment,
Mm-hmm.
which, again, logically, you know, you adjust your spinal column so everything flows out,
Mm-hmm.
which, again, natural stuff.
Right.
So I'm a believer in that, and then I just, again, like I said before, he mentioned your name twice,
Okay.
and it took the second time
Okay.
before I said, where is he, what's his phone number? Because at that point, I was desperate.
You actually picked it up fast. A lot of people probably would need to hear it maybe 10 or 20 times.
Well, again, when you can't breathe, you're desperate. And I didn't want to do surgery, because I knew that wasn't a cure-all.
You know, a lot of people think, you know, when they hear naturopathic physician, they might think quack. So what do you think now?
I won't say that. I mean, I wouldn't call myself a non-believer, but now I'm a believer.
Okay.
Okay, I give almost anything in this world a chance. I'm try to be open-minded.
Mm-hmm.
I've heard about, you know, naturopathic, well, supplements, food, whatever it is, but and I still believe in medical field too for a lot of things.
Mm-hmm.
But again, when something happens with your health, if you don't have your health, it doesn't matter. I guess it does matter how much it costs, but up to a point where I know it's not so-called. It's relatively not really expensive, but it's not covered under insurance and all that.
Right.
But,
Most people.
right.
Right.
But it got to a point where, you know, to me, it doesn't matter what it costs.
Yeah.
Because I wanted my breathing, my nose fixed
Okay.
for my health.
And that's the beauty of this whole thing, is what we're talking about with the nasal rinses. It virtually doesn't cost much,
That's right.
right? You can
It's
buy
true.
a bulb syringe, which might cost you, I don't know, $5, and then table salts, right? So I know a lot of people are wondering which way they should go. So Dennis, what salts do you use to rinse out your
Well,
sinuses?
personally, I tend to be lazy, so I buy the kit. There's a kit out there with
Okay.
not the Nelly pot with the squeeze bottle. It's a little
Mhm.
squeeze bottle. So I buy the
Okay.
kit. And
Where'd you get yours at?
Well, the first time was Longs
Okay,
on sale.
okay.
It's pretty reasonable.
All right, there you go.
Right, you can buy the kit, which has the bottle and a packet of rinse, 50 rinses, or
Okay.
they also sell the packet box, which I think has 100 rinses in it,
Okay.
on sale for $10.
Wow, that's a pretty good price.
So, and like I have high blood pressure, which I do take blood pressure medicine for
Okay.
that. So that's why I use the rinse too. I mean the packet.
Right, you want to avoid the sodium.
Right.
Okay. How about you, Russ?
For me, the mornings I use the salt, the quarter teaspoon salt with 10 to 12 ounces of water.
Okay.
And in the evenings, I use the premix pack, which Dennis was talking about, where they have, I think one packet is for 8 ounces of water.
Okay.
And the reason I just mix it up because the pack itself, to me, it doesn't burn as much as just using the salt and water.
Okay.
So I use a combination of both. But I use the nasal bulb, which you had shown, but it was actually
a
a
bigger
bigger one.
Okay.
The one that you get from the hospital for when you have a child, to suck up all
Oh,
that
yeah,
goo.
yeah, okay.
It's a bigger size bulb that I use because I can shoot more water into my sinuses.
Right, okay. And talking about shooting the water in your sinuses, before we end and before we ask you your last questions, Russ, you don't want to press the bottle or the bulb too hard.
Correct.
You want to.
Right,
You don't want to
right.
be like projecting it in there at a really high force, because your sinus cavity is somewhat gentle tissue, but it can't tolerate a lot of heat or hot water. So it's basically hot tap water is what we
Right.
recommend you use. But Russ, tell us what happened when you were really getting into the nasal rinse.
I was really getting into the nasal rinse by, and I know you laugh about it because I was to the point where I would squeeze that bulb and you would have a force of water going down my nose. Well, at the same time, as soon as I did that, my nose started to bleed. And that's when you told me you can't be shooting that water with such force because your tissues, will tend to tear. So you got to be a little bit more gentler.
Right.
So ever since you told me that, my nose has not bleed any time already. So it's the pressure is very important. Do not put too much pressure into
Right.
it.
You need to have firm pressure though
Yes.
to get it in the back of the sinus cavity. But you don't have to really like blast it in there.
Yeah,
Right.
I've learned my lesson on that.
Well, I think the bottle that comes in a kit that's why it's designed, because you really can't, even if you squeeze it hard as you can,
It won't.
it won't explode into your nose.
Oh,
It's
okay.
just the right amount of pressure.
All right.
Or you can squeeze it softly too. So,
Okay.
but if you squeeze it hard, I don't think there's enough pressure that will squirt it up with too much force.
With too much force and hurt your sinus
You're
cavity. Dennis, you had mentioned that you bought your first kit at Long's Drug Stores. Where'd you buy the following kits, or where are you getting them now?
Well, wherever's cheaper.
Oh, okay.
Well, Russ mentioned that I guess it can buy from Amazon.com, which I
Okay.
am going to look.
Okay.
You can go online.
Yeah,
Right.
and pick it
Just
up
the
there.
packets, yeah,
All
or
right.
the kit as well.
All right.
So.
So Long's has it on sale once every couple months or once every month. So I buy a packet and stuff like that.
Okay.
from
Long's Drugs. All right. Russ, how about you? You probably hadn't heard about naturopathic medicine before you came in to see me.
No, I haven't.
Okay.
I haven't heard much about naturopathic medicine. And again, like Dennis, you're kind of like my last hope because, Hawaii being so small, you talk to people, and, our best man on our wedding party actually was a patient of yours. He had eczema, I believe.
We can
and
mention his name.
Milton.
Milton was on our. We filmed a couple of programs with Milton and his
Yeah.
eczema, so
And-
a lot of people still remember Milton.
Yeah,
Sorry.
he's a typical, no frills guy. He'll just tell you as it is. You gotta go see this guy, Dr. Uchida, because he's the bomb. He cured my eczema, although he was on a very strict diet,
Right.
which cleared up his ailments. So that I had a business colleague that had, I believe, Meniere's
Disease.
which is kind of like vertigo. He had ear problems.
Very severe vertigo, extreme
So-
vertigo.
He recommended you also as well. So, throughout this course, I've learned naturopathic is something that people should consider when all other options fail. Because if it wasn't for you, who knows? I would have still been on omeprazole or acid blockers, nasal steroids,
Mhm.
and it's still not curing it. It was
Right.
kind of like a Band-Aid. They're putting it on you, but I want to cure the cause.
Mhm.
So, thank you very much.
So what I've been finding out is that vertigo and Meniere's disease a lot of times is caused by chronic sinus problems. The fluid building up in the middle ear because the sinuses are really congested and filled with fluid is causing the balance or imbalance problems. So that gentleman had pretty good results.
Yes,
Yeah.
he did.
So you didn't know much about naturopathic medicine before? I mean, a lot of people when they hear naturopathic physicians, they think quack. What was your
Correct.
impression initially?
Well, initially, because I wasn't familiar with naturopathic medicine, it was, I was like Dennis. I ran out of options,
Okay.
and I was willing to try anything.
You were
Not
Not saying,
desperate.
Yes,
not saying
we
you're
were
a
desperate.
quack, trust
Very
me, but
desperate.
I ran out of options.
Yeah.
And to me, my doctors couldn't help me,
Right.
so I needed another option, and I was willing to try anything.
Mm.
And thankfully, your name came out. The two people recommended you, and that's why I'm here today. I mean, it's a testament to you and your practices because you really helped my nasal congestion, my earache go away. So
Oh,
I'm a
what's-
believer, 100%.
Okay. So your impression of naturopathic medicine is pretty positive now.
Yeah, I mean, I would tell anybody that has similar issues like us, like Dennis and I, or anything else, if they feel that they're out of options to give naturopathic medicine a shot, because I think it does work.
You know, the treatment recommendation I gave you to using the nasal rinse, not a sexy kind of treatment, kind of takes a lot of work and effort. What did you guys think about that recommendation initially? You know, did you see it as being, you know, an obstacle or?
Not for me.
No,
No?
me neither. Because
Just
when
a-
you're all out of options, you're going to try something.
Right.
And-
You're desperate. You're desperate.
And
I guess that's the message you're giving the audience, is that you guys are desperate. You're willing to try anything.
Well, but
Wow.
I want to say that I'm open-minded on different things, but I'm also a skeptic.
Okay.
I'm willing to try it,
Yeah.
but I'm a skeptic.
Yeah.
That's why, like, when Dr. Ryder mentioned your name first, a naturopath, I said, you know, well,
A little skeptical.
yeah, I'm a
Yeah.
skeptic.
But that's understandable. You know, I think 90% of America probably would be skeptical.
And then I wasn't sure what to expect when I came to see you.
Mhm.
Because, again, everybody formed a mental image of whatever something you're doing or going to or work with.
Mm-hmm.
And when you think of naturopathic physician, you know, you're not seeing like a doctor or a surgeon, something like we're quote a professional.
Right.
So I wasn't sure what to expect, but I'm a believer. Now I am, because
Okay,
it works.
I'm glad. You folks don't want to wait till you're desperate like these guys were. So, you know, see your naturopath sooner than that, but just kidding. We forgot to mention one thing. You know, I think, Russ, you mentioned something about food. So I did make a recommendation to you,
Oh,
to you
yes.
both, right? To
Right.
watch certain foods because they could cause sinus congestion or phlegm buildup in the sinuses. Dennis, what were those
Well,
recommendations?
No, you helped me because I forgot about that. But you did give recommendations to cut out, well, ice cream, milk, cheese, and
Dairy products.
I love ice cream.
Okay.
So that was a little hard, but I haven't touched ice cream since you made that recommendation.
Oh, okay.
I've instilled in my steel will inside here and said no ice cream. So
Good
that's
for
fine.
you. But you probably ate some dairy along
yeah.
the way. What did you notice the effect on your body
I
was?
think I told you one time I had you know, it's been good, so I'll have a pizza.
Mm-hmm.
And it seemed like right after that, the next day, everything flared up again.
Just congestion.
Yeah.
Right. So dairy products, unfortunately, does cause phlegm buildup in the sinuses. How about you, Russ? Which foods did I
the
recommend
four
you avoid?
you said to stay was corn, soy, dairy, and citrus.
Okay.
Those were the four, which to me the hardest one I have trouble with is soy, just because we're in Hawaii, everything is terry beef,
Oh,
terry
right,
chicken,
right.
soybeans, tofu, and I love all those. But like Dennis was saying too, when I eat those, I would tend to start to get a little bit more congested, I notice.
Okay.
So I'm working on staying away from those items. But
Right.
it does, I do feel it when I do eat it.
Eat
though.
them.
Yeah.
Yeah, a lot of the audience probably wondering, how can you tell that, you know, those foods are affecting you? It's mainly because the nasal rinse helps you drain your sinuses,
Right.
so you can breathe better, and then you'll notice a pattern right after you eat a certain
Correct.
food that it starts to congest. So these gentlemen, they had taken notice of those foods when I had mentioned them, and that's
Right.
the reason why they picked up clues to which foods might be affecting them.
Correct.
All right. We're almost done. I want to mention that to the audience that, you know, if the lighting in this program looks a little bit dim, the guys suggested maybe we turn down the lights because they didn't want all the blemishes and their age to show up on TV. No, I'm just kidding.
Well, he's a naturopathic physician, so he said natural.
That's right. No
Yeah.
makeup. No
Yep,
makeup.
no makeup. I did ask for makeup.
Yeah. All right, you guys. I want to thank you guys so much for sharing your experiences with naturopathic medicine and how much better you're feeling, and explaining the innuendos with using the nasal rinse properly. Really appreciate that, guys.
Thank
Welcome,
you very
thank you.
much. Thank you for having us, and thank you for helping us with our issues.
You're welcome.
Thank you. Okay.
Good job.
That was good.
I'd like to thank all of you for tuning in and joining us today. I hope you enjoyed the program and learned something of value. Our hope is that in these stories, they inspire in you the hope that true health is attainable. and you can have it whenever you're ready. Please continue to look for and tune into Island Wellness on Olelo Television. We have more incredible heartwarming stories of people overcoming chronic disease and illness in the next few months. Watch Ron, the Miracle Man, tell his story of beating the paralyzing multiple sclerosis with naturopathic medicine. If you're still wondering if naturopathic medicine really can cure psoriasis, tune in to watch Annette and Evelyn tell you their stories 2.5 years later and update you on their psoriasis status. Jason returns to update you on his epic battle against the deadly genetic cancer of von Hippel-Lindau disease. Finally, can naturopathic medicine heal a severe skin infection without antibiotics? Did you ever hear the adage, a picture is worth 1,000 words? Well,